Emergency situations call for quick, responsive thinking and acting. To avoid being frazzled during such an event, take the time now to familiarize yourself with your trauma bag and its contents. First and foremost, your trauma bag should be in an easy-to-locate place that all crew members are aware of. If you have one in your truck, make sure it is available to the crew members at all times. Each trauma bag is equipped with an AED and should be inspected monthly. We won't discuss how to use the AED in this video, but take the time to look it over or ask safety for a refresher. The two side pouches are meant for quick access to items needed in the event of a severe trauma, likely while you are waiting for EMS to arrive on scene. In one pouch you will find a tourniquet if needed to stop massive arterial bleeding. A Sharpie is included for you to write the time the tourniquet was applied so EMS can take that info with them to the hospital. Write this somewhere, such as clothing or even on the patient's forehead, as long as it will be with them when being transported. For heavier, hard-to-control bleeding that might not warrant a tourniquet but still needs to be stopped, the trauma bandage can be applied for direct pressure. There's also an occlusive chest seal to be used for open chest wounds and an emergency blanket to keep the patient warm in the event of massive blood loss or early symptoms of shock. On the other side pouch you have a CPR mask, a splint to stabilize any fractures, as well as a triangular bandage as needed to secure limb to body in the event of a fracture or other injury. To access the contents on the inside, flip the bag over. Note both side pouches can also be unzipped when the bag is in this position as well. Loosely in the main pouch you will see 2 ice bags, a blood spill kit, and medium or extra large gloves. In the back main pouch, think of this as your burn pouch. Here you will find 3 various sizes of burn dressings to apply as needed. Also, due to its large size, a large trauma pad is in here as well. The main pouch has 3 smaller bags within it. There's a bag dedicated to eye care, moderate bleed care, and general first aid. In the eye care bag, you will find 2 sterile eye patches, a contact case with contact solution, sterile eye wash or flush, and a pen light if needed to check for pupil dilation. Use the moderate bleed bag for wounds that aren't traumatic in nature, but yet large enough that a simple band-aid won't do. In here, there are larger gauze pads for you to clean or use to help apply pressure to the wound. You can use the bleed stop packets to help stop bleeds. It is a powder substance that you can pour right into the wound to help it clot. Adhesive tape is also here to help tape down the gauze pads. In the largest bag, we have general first aid items. This is the bag you are likely to use most. There are various sized band-aids and gauze pads. Telfa or non-stick pads are good for scrapes or abrasions, as those can get gummier in the healing process and these bandages won't stick to the scab. Butterfly wound closures are good for deeper lacerations and to help close the wound together. Burn gels are for minor burns. Antibiotic ointment should be used on wounds to avoid infections. Hydrocortisone cream is there for any skin irritation or itching. There's a box of sting and bite ampules. If you get stung by an insect, simply take an ampule out of the box. Remove the glass from the cardboard casing, flip it, and place it back into the sleeve. Then squeeze at the dot to break the ampule as the video shows. This will allow the liquid inside to seep into the applicator tip, where you can then apply it to the bite for pain relief. Inside the yellow box are smaller or individual items. Included are a few packets of ibuprofen, Benadryl, scissors, tweezers, a tick key, moleskin patches which are good to place over blisters in order to create a barrier that will stop the friction. There's also a thermometer that you place on the forehead to read, and also some hand sanitizer. Keep the trauma kit up to date, stocked, and ready when needed. Contact safety for any expired items or any items needing to be replenished.